Breast. Breast is a modified sweat gland which is a type of apocrine gland. It is present in both males and females, but in males it is a rudimentary in development, while it is well developed in the females at the time of the puberty. In adult female, it is seen as a soft hemispherical protruding organ on either side of the pectoral region, means over the chest. If I talk about the structure, the breast is composed of mainly three components: skin, parenchyma, and the fibrofatty stoma. The skin is further composed of nipple and the areola. The nipple is a dark conical projection of the skin in the center of breast. It is pierced by 10 to 15 lactiferous ducts and contain smooth muscle fibers, while the areola is a circular blackish discoloration around the nipple. It contains numerous modified sebaceous gland which secretes oil and lubricate and prevents the nipple from drying and getting cracked, while the parenchyma is consist of the glandular part which is made up of alveoli, lactiferous duct, and the lactiferous sinuses. The fibrofatty stoma is composed of the fibrofatty tissue which consists of the fibrous septa, which is present of the ligaments of the Cooper, which extends from the skin to the pectoral fascia and divides the glands into 10 to 15 lobes, while the fatty stoma lies between fibrous septa and the glandular part. The location of the breast is located on the either side of the superficial fascia of the pectoral region. The extent of the breast is it extends vertically from the second to sixth rib in a mid-clavicular line, while horizontally it extends from the lateral border of the sternum to the mid-axillary line. If I talk about the relation of the breast having superficial relations and the deep relations. The superficial relations of the breast is mainly skin and the superficial fascia. The fascia mainly is the pouch or polythene-like structure in which a particular tissue is present so that it can cover the entire tissue or the muscles. That is what we call the fascia. While the deep relation of the breast is the pectoral fascia, means the pouching of the fascia which covers the pectoralis muscles and the three muscles including the pectoralis major which is present medially, serratus interior which is present laterally. Medially means towards the body and laterally means outside the body, outside the midline of the body. So serratus interior is present over the lateral side, means outside the midline of the body, while the pectoralis major is present toward the midline of the body. And one more muscle, that is the external oblique, which is present inferior medially, means it is present inferior means below, and medially means toward the midline. If we talk about the blood supply of the breast, then it is composed of arterial blood supply. The arterial blood supply is the one which carries oxygen and nutrients to the breast tissue. The venous drainage of the breast is the one which carries the waste material from the breast and the breast tissue to the right side of the heart, and from there it go to the lungs and get oxygen, and then again it go back to the left side of the heart and gets converted into the arterial supply and carries the oxygen and nutrients to the breast by the arterial supply of the breast. So the arterial supply is mainly consist of the internal thoracic artery through its second, third and the fourth perforating branches, and the lateral thoracic artery, superior thoracic artery and the acromiothoracic branches of the axillary artery, while the lateral branch of the breast is consist of the posterior intercostal arteries, while the venous drainage which carries the waste material and the excretory products from the breast is carried out by the axillary vein, internal mammary vein and the intercostal vein. Now the lymphatic drainage of the breast. Lymphatic drainage are the one which carries the waste material not through the blood vessel, but it carries the waste material from the spaces or the intercellular space of the breast tissue. So it drains into the two sets of the lymph vessels. The one set which drain the parenchyma and nipple and areola, the another set which drain the overlying skin, but it does not include nipple and the areola. Though nipple areola is the part of the skin, but it is not drained by this second type of the drainage system. So the lymphatic vessels which drains the parenchyma including nipple and areola form the subareolar plexus of the sappi, which drains as 75% into the axillary group of the lymph nodes, which chiefly drains into the anterior group, and the 20% get drained into the para-sternal groups, while the 5% drain into the posterior intercostal nodes of the lymphatic drainage. While the another set which drains skin excluding the areola and nipples, it drains directly into the axillary node from its outer part, and then the supraclavicular lymph node from upper part, parasternal node from the inner part, and the subdiaphragmatic node from the inner part. We all know the breast or the mammary gland is the features of the mammals. Like the mammals are the one which get differentiated from the other species living over the planet. So the mammals is having breast, and the other species other than the mammals, they are not having the breast. And the breast is an important part in the body as it gives nutrition to the newborn during the pregnancy. And the breast carcinoma is the second most common carcinoma of the females, and in India and in the United States it is the major common cause of the death in the females carrying any particular type of the carcinoma.